So Caitlin, bring us back to maybe 2 months ago or so. I think it was around the middle of January. You came to me and described what your symptoms were at the time.
So I had left hip pain for a few months, and it was a constant pain that I couldn't do anything to make better. Certain things did make it worse, but it was a pretty constant, very pointed spot on my hip that I just couldn't resolve.
How long before, you said 2 months, but had it gone on for 2 months?
I had alternating symptoms for a couple years, starting with when I had a baby.
Yep.
And I'd had some different symptoms treated, but couldn't have everything resolved, and the one remaining symptom was this left hip pain that no one could really figure out.
What were the other symptoms that were improved by other therapy?
So I did have some sciatic light pain, some shooting pain down to my left heel, and then also some lower back pain for a little bit that was resolved by some things, some different therapy, but not the hip pain.
Yeah. Tell me about the pain in those last 2 months prior.
So I could not even lay on my left side when I would go to bed because it hurt so bad. I was able to sleep, but then as soon as I would wake up, within a couple minutes, that pain would just come on, and then it would continue throughout the day.
Yeah. We measure things like, to what degree is this pain affecting life, and all through some questionnaires. You just got through doing that again for me. But also, like, how is it affecting your ability to cope with life and all? And yours was not so hot.
Yeah.
How was it impacting just your ability to deal with kids and family and life and all?
It was really starting to affect my mental state because I had seen a handful of people and a handful of different even physical therapy specialties trying to figure this out, and everyone I talked to, they would appear to be very overwhelmed by what I was telling them.
Oh, really?
Which was really unnerving to me because I didn't know what was going on, and then all these people were really trying, but they really, I could tell that they didn't really know what to do with it either.
Yep.
So that was very disheartening. And I had spent all this time in seeing these people, and then I was still in pain.
Yeah.
So I felt like I was running out of options,
Yep.
and that I was just going to have to live with this pain for the rest of my life.
Yep.
And I'd kind of gotten to that point, and it was really affecting my mental state in just like everyday life.
Do you remember the first day? I'm always interested to hear people who've been through a lot of therapy before and then the experience, because sometimes the training that I've had is a little different. Was it the same or was it different?
It was very different because we did a movement, and you said, "How does that feel?" And I said, "It hurts." And you said, "Okay." And everyone up until that point, if they made me, even if it was in an evaluation, not necessarily an exercise, they would ask me, "Does that hurt?" And if I said anything more than no, then they would tell me, "Okay, don't do that."
Gotcha.
So when we did a movement and it hurt really bad, you were not fazed by that. And I also felt like you weren't intimidated by my complicated 2-year-long changing and adjusting history of whatever this was that was going on.
Yep. So you had a lot of things that weren't so much killing you, but it was that middle moderate pain. It's just like a nuisance. I just want this gone, right?
Yes.
But you also there were things you weren't doing that you enjoy doing. What were some of those things you had to stop?
So I was told not to lift anything over 5 pounds, and I was told not to do any exercise that was more than just a moderate walk upright. I wasn't supposed to do anything leaning forward, so I used to do spin class a lot, and I was told not to do that. So pretty much the only exercise I was doing was walking.
Yeah. Okay. And previously, the spin class, lifting weights, running,
Yes.
those are all things you enjoyed.
Yes.
Or at least did.
Yes.
Yeah. Okay.
Yes.
Gotcha. All right. So now, 2 months later here, I guess maybe even go back for the first few visits. How long before you started seeing any changes in your symptoms with what we were doing?
Just a few days.
Okay.
It was really hard work.
Yes.
And it wasn't, it was, relatively painful for my particular problem, but I did see a correlation in a decrease in my hip pain as we kept working on that area.
Yeah. What was painful to do?
It was just moving my back in the way that it needed to be moved because it hadn't been moved in that way for a long time, and I'd had this problem for so long that it just took a lot of effort to reverse all that time.
Yeah, okay. So it was more the back that was uncomfortable doing what I was asking you to do.
Yes.
You had your husband involved, giving you some pressure on your back. He's still involved.
Yes.
Okay, but as you were making your back a little bit sore, or quite a bit sore, by doing such a maybe more vigorous work and movement into that stiffness or that pain, what happened to your hip pain?
It got better.
Yeah, okay, so we saw that change. All right, and so now, where are you now?
So I'd say I'm 95% better.
Yep.
I'm still doing the exercises and incorporating that into daily life now.
Yep.
And I'm able to do even simple things that I wasn't really even considering before. With no pain, I can sleep on my left side. I'm getting back into lifting weights and running and spin class and all the things that I would like to do.
And the sitting on the couch, nice and slouched.
Yeah.
Finally, back to the couch.
Finally.
Gotcha. So where does this leave you in your psyche, your mind, in terms of like, okay, is this going to be something I'm going to have to deal with for the rest of my life? Are you still having those thoughts, or where are you with that?
I feel like I'm aware of it now, and this might just be something that I will have to put effort into. So I'm not worried like I was before. I feel a lot more educated about it and not so afraid of it.
Yep.
Because I now know more of what the problem was, so I know steps to fix that.
And a lot of times people want something that they can do for themselves to make it feel better. You feel like you have that?
Yeah, I feel like I have the knowledge and the tools that I did not have before.
Yeah. And you had mentioned to me today that you didn't necessarily anticipate this might happen, but there was a period of time in the last week or two where you kind of forgot you had a hip problem. What were your thoughts about that?
I just never thought I would ever get to that point. It had gotten to, it was just on my mind all day because I had been told by so many different people all the things not to do. Don't sit a certain way, don't move a certain way, don't stand up a certain way. So all that information just kept building over the 2 years to where it just took over my entire life. Every time I stood up, I thought about it, or walked, or laid down, or whatever. And so when I got here, it was all I thought about.
Yeah.
And now, over the past couple of weeks, I've had moments at the end of the day, I think, oh, I haven't even thought about my hip.
Yeah.
And it's been 2 years.
Yep. Long road, lots of hard work, good bit of pain, but you persevered. So you did a great job. I appreciate you being able to share your story.